Hi guys, today we're going to talk about symptoms of head injuries, concussions, head traumas. So symptoms are very important for certain factors, but is it also a factor that you want to rely on when you're doing your rehab? Well, yes and no to a certain extent. So before we get to that, let's talk about symptoms in terms of giving us information. So when it comes to symptoms, symptoms allow us to have a good idea of potentially what part of the head is being compromised, what systems need to be worked on in terms of helping in your rehabilitation. If we look at headaches, well, is it a tension type headache? Is it coming from the back of the head and kind of looping up? Is it a more generalized headache that's kind of just pulsating either between in the forehead or behind the eyes? So symptoms with regards to that helps give your healthcare practitioner some knowledge in terms of what might be going wrong with you and how they can help you even more. When it comes to symptoms, you also have to be concerned about or be mindful of is symptoms help kind of tell you how hard or when to stop pushing on yourself in terms of therapies. So a lot of the research right now shows that you want to be sub-threshold in terms of pushing yourself with rehabilitation. The only way you can do that is if you're conscientious of your symptoms and you're kind of listening to them to see kind of when they're either increasing in intensity, so that you can kind of step back off the gas a little bit with some of those exercises or the environment that you're in. Now, that begs the question, well, where does medication sit into this mix? Medication is one of those things that can be super helpful in terms of getting you from day to day. However, sometimes it might not be the best idea to have medication all the time because it kind of helps mask some of those symptoms that actually might be giving you a reference point in terms of how hard you should be pushing yourself. So, medication can kind of go both ways in terms of being very, very helpful, but it can kind of hinder you a little bit in terms of really knowing what's going on within your head itself. So the other thing to look at when it comes to symptom base is in your rehab process, if you're symptom free, does that mean everything is okay with you? Well, that's a good question because some patients might not even know there's something wrong with them right away, but all it takes is a very small little nudge to the head, and oh my God, things are really worse again. Does that mean that small nudge knocked them over, or was the last hit that kind of rung their bell? Sometimes that's not the case. Sometimes what happens is our brains are great at changing, at adapting. Our brains want to make sure that we're able to survive, we're able to function. But just because they've adapted does not mean that everything is perfect inside. So when it comes to rehab, sometimes when you rely just on the symptoms, it might not be a good indicator that the brain is doing okay. All it might be saying is that your brain is doing okay for you to not have symptoms at this time. So sometimes it's more important to look at some more concrete kind of scientific literature in terms of seeing, are your reaction times par for what they should be? Are your eyes performing the way they should be for someone who typically doesn't have any head injuries? Is your balance appropriate for your height, your age, your weight? So when you look at some things that are a little bit less symptomatic and a little bit more concrete in literature, it helps us to have a little bit more of a foundation to know not only at that point you might be symptom free, but you are also performing really well on a lot of those standardized tests. So symptoms are great because they give us a lot of important information, but sometimes we don't want you to rely on them solely because there are certain factors that come into play here that are sometimes more important than the symptoms alone.